Friends, I am Thanikainathan, student of PGPPA program at IIM Trichy. This video recording is part of my assignment for the course Indian Economy and Policy. I am going to talk about broadening access to health and finance to poor and vulnerable sections of the society. When we talk about broadening access to healthcare, we have to consider the key aspects like access, funding, and the quality. Fine. Where do we need access? Well, we need access to all the categories in the society. Okay. What are all the stumbling blocks to this access? Is it only infrastructure? Or qualified doctors? Or paramedics? It's more than that. In my view, even the mindset of people in rural areas still hesitate to visit healthcare centers. Fine, what do we need to do to overcome these stumbling blocks? Yes, it's the awareness, money, and a proactive healthcare policy. Why do I insist for a healthcare policy? There is a reason to it. When a person wishes to travel in an aeroplane, it is a matter of choice to him. Whereas, when a person has a health issue, he has no choice but to avail the treatment at the nearest facility. Well, now the question is, can he really afford such a cost? There comes the role of healthcare policy in the country. The healthcare policy should ensure access, finance, as well as the quality. Now the question is, how to ensure access, finance, and the quality? If we recollect, during early 2000s, to bridge the growing infrastructure deficit in the country, the government has introduced public-private partnership. Now, we have witnessed the massive development in the infrastructure since the introduction of such public-private partnership. Similar concepts needs to be introduced as a part of 5-year plans in our country. These kind of policies will increase the medical institutions and also the doctor-patient ratio will get improved. At the same time, the policy should provide for priority in development of medical infrastructure in the rural areas because big hospitals like secondary care, tertiary care are also situated in metros and tier 2 cities. The objective is to ensure quality healthcare across the country and for all the sections of the society. Now one may ask a question. When we have premier institutions in the country, how the medical institutions developed under PPP model will survive or get patients? Yes, we have successful business models in India like Aravind Eye Care, where they provide free as well as paid services. All the sections of the society visit Aravind Eye Care and avail services. So, when there is a quality, people will trust and visit the hospital, though it is developed by a PPP model. Fine. Now, what are all the checks for effective implementation? Well, the accountability should remain with the government so that the pricing, mismanagement kind of things will get eliminated. Great. Chanakya, in his work Arthashastra, beautifully stated, in the happiness of his population rests the ruler's own happiness. In their welfare lies his welfare. He shall not necessarily consider as good whatever pleases him, but he shall consider as good whatever pleases his population. So, it is a duty of government to implement these kind of policies in a time-bound manner for the welfare of the society. From a timeline perspective, the 5-year plans can be used as a tool for implementing these policies. No one can defeat a powerful mind with this quote. I will leave it to you to think about PPP model. Thank you everyone.